Hello everyone, my name is Lauren and I am a registered nurse, an oncology certified nurse, and the unit educator on the hematology oncology unit here at a academic medical institution in the San Francisco Bay Area, California. And I am here to talk to you about activity and exercise in our patients with cancer. Activity and exercise for our patients who have been diagnosed with cancer is absolutely crucial on their healthcare continuum and their road to recovery and ultimate survivorship. As a nurse, when we approach a patient's health and well-being, we always approach from a holistic standpoint, meaning that we're keeping the mind, body, and spirit at the forefront of all we do. For our patients who have been diagnosed with cancer, empowering them to be active, independent members of their healthcare team through exercise is crucial for their continued success and ultimate recovery. When we talk about the mind for a patient who's been diagnosed with cancer, we're identifying and recognizing the huge shift in a person's life from point of diagnosis through treatment and ultimately to recovery. Oftentimes, when a patient is diagnosed with cancer, a lot of their control in their life is being taken away when they choose to pursue treatment. Oftentimes, treatment schedules and treatment regimens are very rigorous, whether it be surgical, radiation therapy, chemotherapy, and a patient's normal routine is disrupted. So we want to try to give a patient back their sense of control and their ability to dictate at least some aspect of their everyday lives. We can do that through empowering them to exercise and through empowering them to have control over the activity that they choose to participate in during their healthcare and chemotherapy treatments and ultimate further cancer treatments. We also want to take into account the body. So when we think of the body for a patient with cancer and a patient who is undergoing cancer treatment, we recognize that the treatments that they undergo can be grueling. They can be very rigorous, and if a patient does not maintain their physical stamina, they often risk hospital-acquired injury, hospital-acquired infections. So by promoting exercise and activity in a patient with cancer, we are able to give them the control to have ownership in their care and prevent these hospital-acquired illnesses and injuries. We also want to think about the spirit. So when we think about a person's spirit, we think about the things that bring them joy. Oftentimes, a patient who has been diagnosed with cancer, as I said previously, their whole lives have been disrupted. So we want to try and bring it back to a patient-centered focus, a holistic approach of care, and identify what brings you joy. What are your goals, short-term, intermediate, long-term goals? If you have a family wedding to attend in 6 months, well, I want to see you go. I want to see you get there. And one way to really encourage a patient to meet these goals and one way to really empower a patient to take their healthcare in their own hands is through exercise and activity. In a hospital setting where I work, oftentimes the day is dictated by many members of the interdisciplinary team, sometimes down to the minute. So I do have to get creative on how to find these moments throughout the day for a patient to capitalize on this activity and to really participate and exercise in a meaningful way. So I have a multifaceted approach. As a nurse, I want to connect with my patient. I want to understand what drives them, what's important to them. And when I can understand what's important to them and what brings them joy, I can also encompass that into my nursing care. And I can help them incorporate activity and exercise into their daily activities so that they can meet their goals. And also, my goals are met too because I see them up, moving, and caring for themselves in a way that they can. Firsthand, I have seen patients be very active members in their healthcare and want to be physically fit and do everything they can to fight that deconditioning, to fight that muscle atrophy. And I've also seen some patients that, for other reasons, they succumb to inactivity. And I do see many hospital-acquired complications rise from that. And every shade of gray in between. I've been a nurse for about 8 years now in the hematology-oncology setting, and I have seen patients walk in strong, able-bodied, and when they do not choose to engage in that activity, I have seen at time of discharge they are being taken home in a wheelchair or on a stretcher, and sometimes they require a skilled nursing facility in order to have the 24-hour care that they now need because they weren't active members during their cancer treatment. I also, on the flip side, I have had a patient who was an avid bicyclist, and her husband brought her bike to the hospital, and we, the nursing staff, we made an environment where she could set up her road bike on a stationary platform, and every day for an hour with her chemotherapy connected on the IV pole, she would cycle. And it was absolutely incredible to see the drive and the stamina, and I didn't see her have hardly any of the complications that often arise from a hospital admission. And what was even more impressive is she would track her recovery and her physiological state on her smartwatch, and we actually could predict when she was probably going to enter into a neutropenic fever, or we could predict when her body was decompensating due to treatment, and we could intervene more quickly, which was incredible because her outcome, she did great. She excelled through her cancer treatment. So I've seen all shades of gray, and I think the biggest take home, the bottom line, is that our patients with cancer need to be active and involved members of their healthcare journey. Through exercise and through activity, those behaviors are absolutely crucial for promoting overall health and wellness of an individual on their path to recovery and on their path to survivorship. Thank you.